This is the question that 21% of the candidates could answer correctly. So we are going to read the question for you. So you can read it with me or by yourself by pausing the video. I read the whole question and the um, questions and the options, and then we will discuss it. So a 71-year-old woman present to the emergency department with fatigue, diaphoresis, and shortness of breath. The patient has long history of coronary artery disease, hyperlipidemia, hypertension, diabetes. The patient is currently taking aspirin, atenolol, captopril, simvastatin, statin, glyburide. She has been a heavy smoker for 40 years. Her vitals are temperature is afebrile. She has blood pressure that is significantly low, 100 over 65. Pulse rate is 96 per minute. Respiration 25 per minute. It's tachypnic. Saturation oxygen is 91%. So physical examination reveals an elderly woman in distress. Examination reveals distended neck veins, bibasilar crackles, regular pulse and rhythm, and S3 gallop. So now you get to know the patient has decompensated heart failure. So examination of the extremities revealed 2 plus lower extremity edema with clubbing. BNP is elevated. Yeah, now we are confirmed. So chest radiograph shows large heart with increased vascular markings. She is seated upright, pathognomic for heart failures. So oxygen is given, morphine, nitrates, and furosemide are given. But she continues to be short of breath. So what is the next step in the management? Very important question, very important part if you're doing um, step preparing for step 2 CK exam. So what is the next step in the management? So you go through the options like albuterol, digoxin, dobutamine, endotracheal intubation, spironolactone. So think about it, but let's discuss about this thing, that what is the next step in the management of this patient. um, you know, eh, 70 60 70% of the exams on the day, it is kind of like what is the next step in the management. So this is decompensated the heart failure. Everyone knows that we are going to give furosemide, nitrates, already given. So what, the patient is still shortness of has short of breath. So what we are going to do next, then we have to see the options. Albuterol, it's a you know beta 2 agonist, so not given in decompensated heart failure. Can be given in COPD or asthma, but not in this scenario. Digoxin, yeah, it's a sodium potassium ATPase inhibitor. So it is given in heart failure for long-term treatment, but this is an emergency case. So it's a decompensated heart failure. So digoxin has no effect in emergency or in acute settings. So as it only increase the quality of life during uh, the chronic therapy. So we don't give dioxin when the patient is in decompensation, or patient is presenting in the acute setting. So dobutamine, it's beta 1 agonist. So it increase the heart contraction, it increase the pumping of blood to the body, it increases this blood pressure. So that's it could be the right option. So we put a dot over it. Endotracheal intubation. So I don't think so. This patient will be needing endotracheal intubation, as the patient can breathe easily, SaO2 is normal, patient is protecting her airways. So whenever there is, in any scenario, whenever there is endotracheal intubation an option, so you need to look for the GS, the score. If it is less than 8 or maybe 7, if the patient is unconscious, so then you can, or patient is cannot protect his or her airway, patient is cannot breathe or ventilate enough. So in those situations, if patient is very unconscious, patient there is a danger that patient can aspire, or patient couldn't protect his or her airway, then you will go with the endotracheal intubation option. Else, you will not choose this option. Spironolactone, yes, it could be the answer, but so we give spironolactone in the chronic therapy. It increase the mortality and morbidity during um, the chronic settings. If the patient is being treating, later on we can add spironolactone with these drugs, more with these drugs like yeah, she's already taking atenolol, captopril, statin, glyburide, so we can add spironolactone with these, and maybe with digoxin. But right now, the next best step in the emergency department, we need to increase the pumping of heart. So that can be possible by dobutamine, which is beta 1 agonist, increase the contraction of heart, so more blood will go out of the heart and less blood you know pooled in the lungs, and the patient can breathe easily. So more blood goes from lungs to heart to outside of the body if heart is pumping more. So um, in that way you can decrease the symptoms like shortness of breath, and you can move more blood out of the heart. So let's see the explanation of this question. So the correct answer is C, as I was showing you dobutamine. You can see 21% of the students got this correct. So the primary underlying defect of congestive heart failure is the loss of contractility. Yeah, everyone knows that. The pump failure. Okay, this patient has systolic heart failure with pulmonary edema. Patient who have congestive heart failure, either systolic or diastolic, are initially treated with oxygen, morphine, nitrates, furosemide already given each of them. So furosemide is given to decrease the preload. If the patient continues to have shortness of breath still, then we add dobutamine, to enhance the contractility, as I told you. This increase the cardiac output, avoids blood pooling in the pulmonary vasculature, improving blood pressure and decreasing pulmonary edema. So this is the correct answer, and I think I have discussed you the incorrect ones, so you don't need to worry about that. So I will be you know adding more questions, and you can give me the feedback. We can discuss that how we will go, how you want me to proceed. So for that, please comment and subscribe my channel. Thank you.